Diabetes is more than high blood sugar. Over time, it can silently damage the nerves that help you feel, move, and even control your organs. This condition is called diabetic neuropathy, one of the most common and serious complications of diabetes. Diabetic neuropathy affects up to half of all people with diabetes. It happens when long-term high blood sugar damages the tiny blood vessels that feed your nerves, cutting off their supply of oxygen and nutrients. This damage can lead to numbness, tingling, burning pain, weakness, and even problems with your heart or digestion. Neuropathy can appear in many forms, sometimes mild and annoying, sometimes severe and disabling. The good news is, with good blood sugar control and proper care, its progression can be slowed or even prevented. Several factors increase the risk of developing diabetic neuropathy. Poor blood sugar control, long duration of diabetes, high blood pressure and cholesterol, smoking or excessive alcohol, obesity and lack of exercise. The longer you live with uncontrolled diabetes, the higher the chance that nerves will be damaged. So, how exactly does high sugar harm your nerves? Inside the nerve cells, extra glucose triggers chemical reactions that lead to inflammation and oxidative stress. Harmful molecules, called advanced glycation end products, accumulate and disrupt normal cell function. Meanwhile, the small blood vessels that feed the nerves become thick and narrow, reducing blood flow. The result? Nerves lose their ability to send signals properly, leading to pain, weakness, or loss of sensation. There are four main types of diabetic neuropathy. 1. Peripheral neuropathy. This is the most common type. It usually starts in the feet and legs, later affecting the hands, known as the stocking glove pattern. Patients often feel tingling, burning pain, or numbness. When sensation fades, even small injuries can go unnoticed, leading to foot ulcers or infections. 2. Autonomic neuropathy. This type affects nerves that control internal organs, the heart, stomach, bladder, and even sweat glands. Symptoms may include a fast-resting heartbeat, dizziness, digestive problems, sexual dysfunction, or abnormal sweating. 3. Proximal neuropathy, diabetic amyotrophy. This rare form causes sudden, severe pain in the hip or thigh, followed by weakness and weight loss. It usually affects one side of the body and improves slowly over months. 4. Focal neuropathy. Focal neuropathy affects a single nerve, often in the head, hand, or leg. It can cause double vision, drooping eyelids, or wrist pain. Fortunately, this form often improves on its own. Early symptoms can be subtle: tingling toes, mild burning at night, or loss of temperature sense. Over time, pain can become constant, sharp, or electric-like. Others lose all sensation and feel nothing at all, which is even more dangerous. Weakness, poor coordination, and balance issues may appear later. When autonomic nerves are affected, patients may feel dizzy on standing, have stomach upset, or experience bladder and sexual problems. Diagnosis starts with a detailed history and neurological examination. Doctors test touch, temperature, vibration, and reflexes. Specialized tests like nerve conduction studies, electromyography, or even skin biopsies can confirm nerve damage. Regular screening, at least once a year, helps detect neuropathy early before serious complications develop. Without proper care, diabetic neuropathy can lead to serious complications: foot ulcers and infections, joint deformities, called Charcot joints, amputations, silent heart attacks due to loss of pain sensation. These complications are preventable with awareness and early management. 1. Blood sugar control. The most effective treatment is tight blood sugar control. Studies show it can reduce the risk of neuropathy by up to 60%. Regular monitoring, medication adherence, and balanced nutrition are key. 2. Lifestyle modifications. Exercise improves circulation and nerve function. A healthy diet and quitting smoking or alcohol greatly reduce nerve damage. Daily foot inspection and proper footwear prevent injuries. 3. Medications for pain. Painful neuropathy can be treated with medications such as duloxetine, an antidepressant, pregabalin or gabapentin, nerve-stabilizing drugs, topical creams like capsaicin or lidocaine patches. These don't cure neuropathy but make life much more comfortable. 4. Treating autonomic symptoms. For dizziness, doctors may advise slow position changes and extra fluids. For stomach issues, smaller meals help. Erectile dysfunction can be treated with appropriate medications, and skin dryness with moisturizers. 5. Advanced therapies. In severe cases, research is exploring nerve regeneration techniques, including growth factors, antioxidants, and even stem cell therapy. These emerging options offer hope for the future. Prevention is always better than treatment. Keep your blood sugar, blood pressure, and cholesterol under control. Inspect your feet daily for blisters, cuts, or swelling. Never walk barefoot, and see a doctor immediately for any wound that doesn't heal. Education and early action are your best protection. Living with diabetic neuropathy can be challenging, but it doesn't have to define your life. With the right care, you can stay active, independent, and pain-free. Remember, small daily habits, good glucose control, regular checkups, and self-care make a huge difference. Around the world, researchers are developing new therapies to repair damaged nerves and prevent neuropathy entirely. The future of diabetes care is brighter than ever, combining technology, medicine, and lifestyle to protect your nerves and your health. Diabetic neuropathy is serious, but it's not inevitable. Take care of your blood sugar, your feet, and your body, and your nerves will thank you.